How is remission defined in acute lymphoblastic leukemia? Imagine a situation where a blood cancer seems to disappear, but the story isn't quite over. In acute lymphoblastic leukemia, or ALL, remission is the goal of treatment, and it has a specific medical meaning. When doctors say a patient is in remission, they mean that leukemia cells are no longer detectable in the bone marrow, and the person shows no signs or symptoms of the disease. More precisely, complete remission means that the bone marrow has less than 5% blast cells, which are immature leukemia cells. Blood counts also return to normal levels, with an absolute neutrophil count above 1,000 per microliter and platelet counts above 100,000 per microliter. This means the blood is functioning well again, and the patient usually does not need blood transfusions anymore. Additionally, there are no signs of leukemia outside the bone marrow, like in the blood or other parts of the body. It's important to understand that remission does not necessarily mean the leukemia is completely gone at a microscopic level. Even when tests show no leukemia cells with standard microscopy, tiny numbers of residual leukemia cells might still be present. To detect these very small amounts, doctors use sensitive tests called minimal residual disease tests. These tests, such as polymerase chain reaction, can find leukemia genetic material at levels less than 0.01% of the cells. Achieving minimal residual disease negativity is a good sign, as it indicates a higher chance of long-term remission. Getting into remission usually involves several steps. First is remission induction therapy, which aims to kill most leukemia cells quickly. Then comes consolidation therapy, which targets any remaining cells to prevent relapse. Since leukemia can hide in the brain and spinal cord, doctors also give central nervous system prophylaxis, often with chemotherapy or radiation, to prevent the disease from returning there. In summary, remission in acute lymphoblastic leukemia is a state where the disease appears to have disappeared based on blood tests and clinical signs. The blood counts are back to normal, and no leukemia cells are detectable with standard methods. However, tiny amounts of residual disease might still be present, which is why ongoing treatment and monitoring are essential to keep the leukemia from coming back. Always remember, each person's experience can be different, and it's important to work closely with healthcare professionals for personalized care and advice.